Okay, at this point, we will open up the floor, both to the audience. I know there are questions out there because I saw y'all bearing witness, as well as to the panels because some of you are like biting on the top. Professor Ball. Other questions? Yes, ma'am. Please do. Can you get the mic too, so we can have you on, so everyone hears you?
I'm really tired, but I'm very happy and honored to be here. I spent the night in the chapel last night waiting to come here to see you today. I was supposed to go back to Illinois yesterday. I'm down here for mini-med school, and what happened is I'd say about 4 weeks ago, I had the opportunity to interview Danielle L. McGuire. She wrote the new book, At the Dark End of the Street.
Oh, yes.
Yes.
We're talking about that at lunch.
Yes. And here, I think I lost my mom in 1990. And I started to realize after being bused to an all-white school when I was about 6th grade, I was the only black girl in my class. And I started to realize that it was something going on more so than just education, and that was the way that African Americans were being treated when they went to the hospital. So I started to do my own research, and when I read this book, I called her and I asked her, could I interview her, and she let me interview her. And in there she talked about Fannie Lou Hamer, who had what they call the Mississippi appendectomy, which is the
hysterectomy.
Yes. And so I'm starting to find out that there's a lot of things that are going on that we still don't know about in our community, about our health. And I think that the racism is still going on there because I've been going around in the neighborhoods looking at the medical facilities. It's something wrong there. And so you were saying that, you know, we should start doing something about that. And I am, but I want to know, what would you suggest that, you know, me as a black woman, you know, trying to get things done, what would you suggest that I do to get the word out?
Well, you should have taken inspiration from that book, because that book is a description of the efforts of black women, almost entirely of black women, arguing against and organizing against the maltreatment of other black women,
Yes.
particularly rape victims, in the early part of the 20th century. And it opens with a description of Rosa Parks forming a movement to defend a black woman who's been raped. This is years before Rosa Parks sits down on a bus, and before anybody's ever heard of Rosa Parks. She's already an NAACP activist, but she jumps into this role, and what we tend to think of as this quiet, sweet lady who just tired, you know, couldn't find a seat on the bus, and so she just sat down because she's, as a confirmed militant activist. You know, the sad thing is, and we academics ought to be worried about this, is Rosa Parks' papers are sitting in an auction house in New York City, and the auction house has not allowed anybody to see the papers, to examine the papers, to study the papers, because, you know, how they belong in some institutions somewhere. They don't need to be broken up and sold apart. And we academics ought to be worried about this and taking some kind of action, I don't know what, to preserve these papers and make sure they come to a safe place. But anyway, so that book ought to give you and other women inspiration of patterns and models you can follow. I think what you need to do is what others have done. Look at the problem, try to find out as much about it as you can, go to people who know more about it than you do, and there are always people who know more about it than we do.
Right.
And ask them, because there are people who are working on this that you and I don't know about, but we can find them and join with them and ask them, how can I help? What can I do to help? And you'll find they'll say, boy, am I glad to see you. I've been waiting for you to come along, and you can do something, because this is a serious problem. And you know, we have so many, many problems. It's hard to say what is the most important one. Let's work on this one. No. This one's more important. No, maybe that one. So you have to pick what's important for you, and I would guess with your history, it's this problem is more important for you than some of the others. Doesn't mean it's the major one, but it's more important for you. So go for it.
Thank you.